Hello friends, today we'll discuss some case studies which will be useful for coding sepsis, severe sepsis and septic shock ICD-10 codes. Since we have checked in previous video about the coding guidelines for sepsis, severe sepsis and septic shock and also the coding sequence for these diagnoses. But if we go through these examples, we'll come to know exactly how we can code these codes in separate scenarios. So here one example is there. A patient is admitted to the hospital with severe staphylococcus aureus sepsis and acute respiratory failure. So in sepsis there will be an infection, and if it is a severe sepsis there will be an acute organ dysfunction or some organ failure will be there. So which we have discussed in the coding guidelines in the previous video. So here, as per the coding guideline, the principal diagnosis will be the infection which is causing the sepsis. So sepsis due to methicillin susceptible staphylococcus aureus. So this is a specific code A41.01 for this infection, followed by the secondary code which is severe sepsis without septic shock. And since there is an acute or respiratory failure, we have to code it again an additional diagnosis for the acute respiratory failure, unspecified, whether with hypoxia or hypercapnia, J96.00. So here the rationale is sepsis is sequenced first in this case because as per the instruction note under category R65.2 indicate to code the first underlying infection. So here if you see, as per the instruction note for code R65.2, we have to code first the underlying infection, such as infection following a procedure, infection following infusion, transfusion and therapeutic injection, pleural sepsis, sepsis following complete unspecified spontaneous abortion, sepsis following ectopic or molar pregnancy, sepsis following incomplete spontaneous abortion, sepsis following termination of pregnancy, and if there is no specificity given for infection, so you have to code the sepsis not otherwise specified code A41.9. Since here we have a specific code staphylococcus aureus sepsis, so we have given A41.01 as primary code for infection. Now in addition, subcategory R65.2 has a use additional code note to specify acute organ dysfunction. Since it is a severe sepsis with septic shock, so there will be an acute organ dysfunction. So there is a separate list also, code additional code with R65.2, which is for like acute kidney failure, acute respiratory failure, critical illness myopathy, critical illness polyneuropathy, intravascular coagulopathy, encephalopathy and hepatic failure. So if you have to code severe sepsis with septic shock, you have to first code the left side, code first infection and then severe sepsis with septic shock, and then followed by an additional code from this list of organ failure. So here you can see we have coded three diagnoses as per the coding sequence. First is infection A41.01, second one is for severe sepsis with septic shock R65 series, third one is the acute organ failure. So this is the first example for coding sepsis, severe sepsis and septic shock scenarios. Now second example also we will check. So here is on second example, the patient is a 85 history old female with who presented to an emergency department with increasing shortness of breath, hypoxia, productive cough and progressive weakness. She is acutely deteriorated in the ED and was emergently sent to the intensive care unit. In the ICU, the patient was intubated, mechanically ventilated for 4 days and started on broad spectrum antibiotics. So here they have given the final DX as septic shock, acute organ failure and Haemophilus influenza pneumonia. So here they have sequence is given like 1 2 3. First ICD code is they have given like septic shock, but septic shock we cannot code as primary because as per the coding guideline which we discussed in the previous video, R65 series we cannot code as primary. So it has to be first coded with the infection followed by the severe sepsis or septic shock and then the acute organ failure code, which we have coded in the previous scenario like I have shown. Now here you see the coding sequence. First code is the infection A41 series, sepsis due to Haemophilus influenza. Second code is pneumonia due to Haemophilus influenza. Then we have a severe sepsis code with septic shock, followed by the acute organ failure code, which is J96.01 for acute respiratory failure. So here if you see the sequence, we are coding first infection, followed by the severe sepsis or septic shock, then followed by the acute organ failure, same like what we have coded in the previous scenario. Here the sequence is very important, because if you code the sequence, if you miss to code the sequence properly, there will be a denial or there will be an error in your coding. So that is the reason you have to follow the coding guidelines, ICD-10 coding guidelines properly for coding sepsis, severe sepsis and septic shock. So here the rationale is for cases of severe sepsis, the underlying infection is sequence first, which we have already followed by a code for subcategory R65.2 severe sepsis, when the reason for admission is both sepsis or severe sepsis and a localized infection, example pneumonia. The code for the localized infection should be assigned as a secondary diagnosis. So here the infection, what is it is causing pneumonia, so we have coded as secondary, and any acute organ failure should be coded as additional or secondary diagnosis, which we have also coded at the last. So these are the coding scenarios for coding sepsis, severe sepsis and septic shock. I think now you should be clear in coding all these three diagnoses, which are very related to each other, but coders get confused in coding them. So please do check out my first video also on coding guidelines for severe sepsis and septic shock, so that all things will be clear in your mind. If you like the video, do share it, like it, and give in your comment section also how you like the video. Thank you, and please subscribe to my channel for more updates in medical coding. Thank you again.